Okay, so for the homework, it says walk through the setup for a knee MRI. So first, we will demetalize, sanitize, disinfect, answer any questions, go over order, follow aided, offer the restroom, place all linens, contrast consent, make sure they have the hearing aid, and squeeze ball. And then what coil is used and how is the patient positioned. We will use the chimney or the HD coil, and the position will be feet first, supine. And then where is the laser landmark set? It'll be the inferior patella, which would be the apex. And then it says describe the angulation and coverage for axial, sagittal, and coronal sequence. The axial will be angled parallel to the joint space. Coverage should be superior to the patella and inferior through the tibiofibular joint. The sagittal will be angled perpendicular between femoral condyles. Coverage should be at least through the bony anatomy. And then coronal should be angled parallel between the femoral condyles and on an axial plane. And then the coverage should include anterior patella and the entire joint posteriorly. Ankle, it says walk through the setup for an ankle MRI, and then once again we will demetalize, sanitize, disinfect, answer any questions, follow aided, go over order, offer the restroom, place all coils, make sure they have the hearing protection and the squeeze ball, and then we will do the contrast consent once again. And then what coil is used and how is the patient positioned. We will use the chimney coil, and then they'll be feet first supine. Where is the laser landmark set? It'll be the malleoli of the ankle, which would be like the little round things on our ankles. And then describe the angulation and coverage for the axial, sagittal, and coronal sequence. The axial will be angled parallel to the tibiotalar joint, and that's like the ankle joint. On a coronal and sagittal image, cover from plantar will be inferior. Surface of the foot into distal tibia and fibula. And then sagittal, we would angle perpendicular to the malleoli on an axial image, and then cover from skin to skin. Coronal, we would use the parallel angle with the malleoli on an axial image, and then we will cover from the metatarsal bases through soft tissue of the heel. And then for the hip, it says walk through the setup for a hip MRI. Once again, we will disinfect, demetalize, sanitize, place linens, contrast consent, offer the restroom, follow aided, offer the squeeze ball, and give them the hearing aid. And then we will answer any questions. And then it says what coil is used and how is the patient positioned. Phased array ABD coil will be used, or the pelvis torso coil. They'll be supine, feet first, or arms on chest. It varies from site to site. And then it says where is the laser landmark set. It'll be the hip joint. Describe the angulation and coverage for axial, sagittal, and coronal sequence. Axial, it varies by the site's preference for the angulation, and then it should always be covered above the hip joint through the laser trocan, I'm not sure how to pronounce that, trochanter of the femur. And then it says sagittal angulation should be perpendicular to the femoral neck on an axial, cover at least through all the bony tissue. Some sites include entire affected side of the pelvis. And then for the corona, we will angle between the hip joints, cover through all the bony tissue of the pelvis, include soft tissues, depending on the site as well.